Well, that's great work going on, Shelley, in your home there at Gilda's Club. Tell us, where did this come from, Gilda's Club?
It's nice to be able to talk about your founder, especially when she's someone who is as well known as Gilda Radner was, comedian way back when for Saturday Night Live. Fortunately, lost her life quite early to ovarian cancer, but her desire in life was to have a place for people to go who were experiencing the same thing she did, to be able to be with people, to share their experiences and just kind of get through their journey as best as they could. So from her experience came Gilda's Club. First was in New York City, and the second, we're proud to say, was in South Florida. And all the Gilda's Clubs after that looked to us and to New York to model after what we had done to try to support their communities, local communities, for anyone who is going through a cancer. And from that, we grew. We went from a very small space donated from Memorial Hospital, thank you very much, to a beautiful home in Fort Lauderdale, historic home. And now we provide services to about 2,600 people a year, including children and families who are experiencing cancer. We offer support groups and educational programs. And again, because the cancer diagnosis affects everybody in the family. When I first came to Gilda 7 years ago, we had a pretty robust children's program, but more and more we were finding that the kids were not specifically coming to the clubhouse, and we wanted to find a way where we could reach more people effectively. And so from that, and this is kind of the short version, came Kids Can, and Meagan worked very hard with us to try to create a program that was going to be meaningful in the community, because we don't want people to be afraid. We worked collaboratively with all the hospitals in South Florida, which is wonderful for us. We're very fortunate to live in a community with great medical resources. You don't have to go very far to find wonderful doctors who are caring and are willing to refer their patients to Gilda's Club for support, and it's very mutual. We have a lot of educational programs right in our facility where people can learn a lot about what's happening. And sometimes I look around and I think, you're right, we are very, very fortunate to have these great medical hospitals and doctors who are so compassionate and educated in what they need to know about cancer.
And do you have a giant staff over there at Gilda's Club?
Oh yeah, we have a real giant staff. We're small and mighty. There are 8 people that work there full time, and that includes our fundraising department and me and our admin staff. We have 2 program people, and we contract with licensed mental health counselors to run all of our support groups. So we've raised the bar in that degree, which has been great. And we rely a lot on volunteers. So at this table, we have 2 of them, and we wouldn't be able to do it without them, honestly.
And what brought you to volunteer at Gilda's Club?
I just love the whole thing about Gilda's. I mean, it's been a wonderful program. I've recommended Gilda's to a lot of my patients when I was still practicing as an oncology nurse. And it's just, the whole setup is just beautiful. They cover education, support, therapy. Nobody is turned away. It's just a lovely program. I started a drum circle, actually. Yep. I started doing a drum circle for anybody that was interested. We do that once a month. And when Meagan mentioned her program, she said, I'm looking for an oncology nurse and one that loves to talk.
Yay!
So, and education is my thing. I really do believe after 30 years of oncology, knowledge is so important, and awareness, and being, it just takes away so much fear. It allows confidence in what's going on. You have confidence in your physician. You have confidence in what's happening to you, and you have that knowledge in front of you. It's just really important. So when she offered this to me with the kids with their fresh little minds, I thought it was a wonderful program, and we've really had a great time. We've had some really great, wonderful, emotional things happen already. It's just beautiful.
Yeah, I think the scariest part for me was the unknown. Mm-hmm. I know before that first chemo treatment, just like the panic, because you hear about chemo and you think, I don't know what that means. What is that going to be? Mm-hmm. And, total breakdown before that first infusion.
Well, we explain it to the children, and when we're talking about chemotherapy, I don't like to just stand up there and lecture. We have a discussion. So we talk to the kids, and they're incredibly smart. They're all born cable ready these days. So yeah. It's wonderful to be able to see how they're connecting. And we talk about chemotherapy. So the last time you had an antibiotic, you had chemotherapy. So you want to take some of the fear out of it and remove some of the shadow from it. It's a wonderful process. I'm loving it.
And your employer lets you have the time?
Oh, yes, and I have to tell Joan Buddy, my administrator, said, you need to do this. And so even though I'm here today, I'm still working, and Focus Care Home Care is a wonderful place to be these days. We are a nursing, but we also do palliative care. We work with managing symptoms, and our main drive is oncology.
That's awesome. And you also, you're president, and yet you're a volunteer.
I'm a shareholder at Greenspoon Mortar. And I want to add on to the volunteer comment, because many of our volunteers are actually children, because we also like to empower children to help other children. Ian was only 11 when he passed, and so many of his friends are 19 right now. And so they and their brothers and sisters, they all come out and they help us organize a 5K, and we raise significant funds, much of which we get matched so that we could fund even more research. But we really couldn't do what we do without our volunteers. We actually only have one paid staff person, and we do it all with volunteers, children, their parents, anybody who's willing to help us, and we really appreciate that.
So for people who want to volunteer, how would they
All they have
find
to do
out?
is go to our website, www.icareicure.org. Fill out a form, and we'll absolutely be in touch with you.
So what
Thank
kind
you.
of things do the children do?
Well, during the year, we host a 5K that has attracted in between 1,700 and 2,000 people each year. In fact, this year we had a very colorful component of it where the children were doused with non-toxic colored food starch. And they go out and they either do mitzvah projects or service projects, and they get sponsors, and they help us raise anywhere from $100,000 to $225,000 a year for that 5K, depending on the year. We've done a chef event this year, and at that chef event, we had a jazz band, and it was all student musicians. Other students were helping serve, et cetera. So children do lots of different things to help us, and they really bring in a great deal of our funds.
Wow,
So we
that's
appreciate
terrific.
that.
Count me in.
You got it.
I do all kinds of crazy
You
things
got
to
it.
raise money for the different charities, so I'd be all over that. Oh yes, I've danced with the stars, I have
rappelled off
been
a
a
building?
chef, I've worked, I haven't rappelled down a building yet. I served at McDonald's, I learned how to make a McCafe. So in our last few minutes together, what do you want to make sure that families out there know? What do you think is most important for them to know? I think something about science. What should they be concerned about with this prevalence when dealing with their children?
I think not to overreact, but to lead a healthy lifestyle and communicate with your physicians. I think, one thing we've learned today, especially about communication, is just, talk to your physicians if you have concerns, and talk to your children and with your families after a child is diagnosed with cancer, to be honest with your child, develop trust with your child, don't hide things. No, in this day and age, we don't hide things from our kids. We believe in being honest with them, listening to them, asking them questions if they're afraid, preparing them for procedures. We work a lot with the child life specialists now who will prepare our children before they have needle sticks or before they go for a CAT scan or a scary procedure. So our kids are really smart, like you said. They're really just wired. They're ready now, and as long as we prepare them and communicate, I think that's very important.
Are there signs and symptoms that we should be aware of?
The signs and symptoms of childhood cancer are just the symptoms of everyday illnesses you would, a headache or a fever, or there's really no specific signs and symptoms. If you're worried, you go to your physician, but
don't
nothing
panic.
specific. Don't panic. Don't overreact.
Yes.
Yeah, it's still very rare.
Viewers know I have a
yes.
7-year-old.
Yeah.
I get all freaked
Right.
out
No,
very
no.
easily.
Even though it sounds like a huge number, 15,000 new cases, it's still a very small proportion.
Oh, good. Thank you for that.
Yeah,
That's,
it's-
I think, important for families to know that they shouldn't freak out every time their child has a headache or a sore throat.
No.
It still could be okay.
Right, and I do want to thank all of you for all you do for our children with cancer.
Thank
I really
you.
appreciate it,
Thank you.
and I want to
Yeah,
thank you
it's
personally because my daughter's a childhood cancer survivor.
Oh.
Yeah, she was diagnosed when she was 12 with cancer, had 2 recurrences, so she's benefited from all that you do, and she's now 26,
Oh, wow.
healthy.
Wonderful.
Right.
Yeah, so
Wonderful.
thank all of you.
Yeah, it is nice to know that cancer is not a death sentence anymore.
That's a very important thing that we want to bring across to kids, because I ask them, one of the first things I ask them is, what is the first thing that comes into your mind when I say that word, when I say cancer? And some of them say death. Some of them say hair loss. Some of them say chemotherapy. But it's important that, as you said, when you're taking away something, that they recognize that there are so many resources out there. And the wonderful thing that we're going to these children and letting them know that there are avenues that they can go to. And also making them aware, as you said, making them aware of their own bodies. Being aware, and when they have a problem or when they see something that's not correct, go to someone that they trust and say, you know, I'm a little bit concerned here. And that's something that they didn't do for a very long time.
When do you think they're old enough to know? You know, my daughter came into my life after, and I tell her I was sick, but I'm okay now. But I've never told her that I had cancer. And I don't know that she needs to know, at least at this point. Do you have any advice on that?
I think it varies. I've seen children in elementary school with family members that have a progressive disease or cancer, and a very serious cancer, that go to treatments with mom and give them the most support that they're getting. I mean, some of these kids, they're a lot more resilient and strong than you think. And when you're honest with them and tell them, yes, I'm really sick right now, but I'm going to get better, and I'm working at it. And they work with you. They're very strong.
Wow, that's really powerful. And a good place, I guess, for us to stop. Remember the resilience of children, both for their own illness and for those of their family members who may be ill. As parents, caregivers, healthcare professionals, little can be as devastating as a cancer diagnosis on a child. And as a community, we must do everything possible so that all children can receive the care, nurture, and support they need to thrive. And I'm really proud to be in Broward County, where we have such wonderful resources for our children and for our families. I want to thank Beth-Ann Krimsky, Marianne Watson, Shelley Goren, Dr. Lynn Meister, and Meagan Roloff for their insight on this delicate issue. I've been your host, Cindy Arenberg-Seltzer, President and CEO of the Children's Services Council of Broward County, where our mission is to empower Broward's children to become responsible, productive adults, capable of realizing their full potential, their hopes, and their dreams. For copies of this program or any other episode of Future First, please call the Children's Services Council at 954-377-1000 or visit www.cscbroward.org. Like us on Facebook, and remember to join us next time on Future First, Focus on Broward's Children. Hello, I'm Cindy Arenberg-Seltzer, President and CEO of the Children's Services Council of Broward County. Did you know that the Children's Services Council is the largest funder of programs that serve children and families in Broward? And we are making a difference. 91% of children in our after-school and summer programs improve their reading skills. 96% of families in our family strengthening programs did not have a verified abuse report even 6 months after completing the program. And 93% of youth with special needs showed employability and job skills proficiency. Learn more about the Children's Services Council of Broward County and the impact of the programs we fund by visiting our website, www.cscbroward.org, or call 954-377-1000.